like a wad. You're doing countdown, right? All right, hey, I'm Trav, SmashweRx over at Diablo. I decided to put the Diablo CrossFit sign in the background. We've got Elena holding the camera today. It's super awesome. She's a superstar athlete, by the way, just to let you know, no joke. We're gonna talk about the knee. Knee is a really complex joint, believe it or not. If you look at the way the knee works, everybody thinks it works like a hinge. So we think it works like this, but the last 5 degrees of motion of the knee, it's got what's called the screw home mechanism, so it locks into place. And I've had a lot of CrossFitters, and myself included, that have some small knee issues, some big knee issues. It doesn't matter. The knees take a pretty large amount of abuse when we're doing what we're doing here at CrossFit, whether it's box jumps or wall balls or squats or anything we do, cleans, squat cleans. I just did a bunch of squat cleans this morning. I definitely know my knees are letting me know that they're there. So that's why I decided to do a knee mobility, but a lot of the problem isn't in the knee itself. And that's where most people make the mistake. I did a really cool video yesterday with Jesse Burdick, and we were talking about the knee and the gracilis and the hip and all that stuff. So I'm gonna continue with some of that, and I'm gonna show you how to take care of that knee without directly even bothering with the knee, with the exception of one mobility, and it's a good one. So when you look at the knee and we look at what we're doing, when we drop into the bottom of the squat, and our feet are nice and about 5 degrees off center, and we drop into the squat, watch what my knees do. They're gonna approximate out, and I'm gonna sit down in that squat, but my knees come out. So in order to do that, that high hip needs to activate, and the problem is we drive. So imagine I'm in my car, and I got my foot on the gas and brake, gas, brake, gas, brake. Right now, grab a seat, see what you're doing, put your hand on your high hip, and you'll feel it engage, disengage, along with the adductors, but that's a different video. The high hip's always turning on and off, so the problem is one side becomes completely imbalanced with relation to the other side, so when we drop into a squat, our squat does this really cool shimmy slide off to one side, and we're not dancing, we're squatting, so there's a difference. So I'm gonna show you how to smash that out, get that tissue to free up, and keep those sliding surfaces, like I always say, moving past one another instead of ratcheting past each other, because if we have two pieces of meat that are glued together, they're not going anywhere. So this way, think of these as big giant steaks, like Jesse said yesterday. We want them sliding past each other. That's really, really important. So the TFL, the glute med, even a little bit of that glute max right here, that all needs to move. And then another spot is there's a muscle called the vastus lateralis. It's the outside of the quad here. It's attached to the femur, and then to all the tendinous structures in here that make up the 4 components of the quad. But the other place it attaches is down on that biceps femoris on the outside here. So it has all this tissue that captures the hamstring, and the hamstring has all this tissue that captures that vastus lateralis. Well, right at that transition, not on the bone, I'll tell you right now, everybody's had a Charlie horse, sucks, so we don't want to do that. You're going to get right in between that. So if you look, there's the belly of the muscle right in here. That's where you're going to be addressing, that's where you're going to use the kettlebell, and I'll show you what we're going to do. It's so catastrophic, but it works really well. So you're going to take the kettlebell, you're going to lay it on its side. This is a 26, okay? For example, like a guy like Jesse yesterday, we used a 44 because his legs are about the size of my waist. So he also squats about 1,000 pounds. So all you're going to do is you're going to get on the side, and the way you get tissue to work and the way you get tissue to strip out is by peeling it through ranges of motion. So we're just going to peel it away. We're going to peel that biceps femoris, we're going to peel that vastus lateralis and a little bit of that IT band, because everything's attaching on that IT band. We're going to peel that away and let them move freely. So all you have to do is get some good support, and all you're going to do is take your leg and go in and out. And you're going to start up pretty high, stay off that bump that you feel on the side of your leg. That's called the greater trochanter of the femur. There's a big bursa over that, big water bag. You irritate that and it'll haunt you for about a month. Super painful, so stay below that, okay? And all you're going to do is back and forth. You're gonna come up higher. Oh, this is so horrendous. Good. And Elena's laughing right now because she knows I'm in pain. And you're gonna go all the way, I heard that. And you're gonna go all the way down, working your way all the way down close to the knee. Now here's what's really awesome and crummy all at the same time. If that's not enough, we're gonna take this, and we're gonna get that on there, and this is so horrific. And we're gonna do the same thing all the way through, okay? So, if it's not enough to put your own weight on there, add a 45. Boy, that gave me the sweats. All right, so that's the one. You're gonna peel those structures. That's 3 things you're working on. The IT band, the biceps femoris, and that vastus lateralis. You're peeling all those structures away so they can slide the way they're supposed to. Remember, the IT band's under what's called a functional load. So it doesn't get loose ever. It'll just get a little bit more pliable, that's it. So that's number 1, okay? Number 2 is, we'll do the high hip. So you're gonna take the lacrosse ball. So, like I said, you're gonna look at my butt, I'm gonna look at someone else's butt, okay? You're gonna take this, you're gonna squeeze your butt. There's a bump right here. That's that TFL and that glute med. That's where the ball's gonna be. You're gonna take this, you're gonna find that hot spot, you're gonna take your foot, turn it out like that, you're gonna trap it with the other leg, and you're gonna take your toe and you're gonna point it up towards the sky. And then you're just gonna mash away. You'll know when you get that hot spot because, like right there, it just lets you know. And all you do is grind away on that tissue, get a minute or two. That'll loosen up a lot of the connective tissue down in here as well because it takes the tension off that IT band. That's number 2. Now, I said there's only one that we're gonna use on the knee. So we're gonna grab a box. You guys have seen this one before. We're gonna do it again. This is called the suprapatellar pouch. And what you're gonna do is you're gonna make sure the lacrosse ball is going all around this area, capturing all this tissue. Just stay off the patella itself. But doing this with your hand, not good enough, of course. So we're gonna take our 45. Check this out, it's like it's made for it. Fits perfectly. You're just gonna find that suprapatellar pouch, and you're gonna find a spot that's just bugging you. And all you're gonna do is do this, back and forth. And you're gonna follow your way all along the top of that knee, and really, especially on the inside, that vastus medialis, that big belly of the muscle right on the inside, it sits right here. And you're just gonna do this over and over again until it gets really soft and loose. That's gonna free up the knee. That's gonna free up the top of the knee, and I promise you this, you're gonna see a lot more knee issues, those creaky, grinding knees that we have when we drop into the bottom of the hole, or in the bottom of that squat. That'll clear a lot of this up. So free up that suprapatellar pouch, peel away these tissues on the side, unglue that high hip, get those knees working the way they're supposed to. Hey, I'm Trev from SmashweRx over at Diablo. I'll see you guys tomorrow.